the TruMont RN apprenticeship is what's called a blended learning program. And by that, we mean there's an online component and an on-site component. So in the apprenticeship world, we have what's called related instruction. And we also have on-the-job training. Related instruction in the TruMont RN apprenticeship is 151 hours, and the on-the-job training is 2,000 to 2,080 hours. This is consistent with the way apprenticeship programs are structured in any profession or occupation. The related instruction piece happens primarily online. So there are knowledge checks and competency evaluations, and then there are learning modules and simulation videos that support any knowledge gap and help close that knowledge gap. In addition to that, online, we have cohort conferences that are virtual in real time. We also have recordings that they access, and then we have discussion forums. And one of the favorite things that they like is the discussion forums, because we post or suggest areas to discuss based on the videos in the cohort conference meetings. And they're able to have peer discussion. The faculty then, because we have TruMont faculty that work with the students all this time, the faculty go in and they evaluate the response that the resident is giving, and they comment to the resident. That's private between the resident and the faculty. However, the posting and the discussion forum can be seen by each other, and they play off of that and add to that, and they really enjoy that. On site, they have their patient care responsibilities and they're onboarding just like they always would. So the preceptor is a one-to-one relationship with that RN resident, and the preceptor is generally responsible for checking them off and coaching them related to a skill checklist. So the skill checklist is something that people are used to using in the hospital for nursing. And it's things like inserting a Foley, starting an IV, appropriately taking a blood pressure. Now, we have content about all of those things on the content side, and we have simulation videos about that to help prepare them. And then on site, the preceptor checks off their skills. When the resident completes the clinical piece of the work and the clinical skill check off, they are handed off, the preceptor hands them off to a mentor. And the mentor is going to stay with that resident and be supportive of that resident through the rest of the year in the on-the-job training, which is their worked hours. And so they are there to help them as the resident goes through the enculturation. It's really their focus to help them become a part of the patient care team and to be a respected part of the patient care team, because in that way, the new person is able to be an advocate for the patient. If they don't feel comfortable as a part of the team and they aren't sure about their own practice, if they see something that they think is not right, sometimes they're hesitant to speak up. And so by helping them become confident in their practice, we help them become a patient advocate. And that's really the goal. At the end, we want them to be a part of their care team and an advocate for their patients.